Bismillahirrahmanirrahim. Assalamu alaikum, viewers and parents. Dr. Zafir with you, and you are watching my YouTube channel. Do you have a child who is stammering or stuttering? Now I will share with you about a childhood stammering. नाज़रीन, मैं आपके साथ आज शेयर करूंगा बच्चों का हिकलाना, स्टैमरिंग और स्टटरिंग एंड व्हाट टू डू. Stammering or stuttering is a speech problem. Stammering is a form of disfluency. That means an interruption in the flow of speech. A child who stutters repeats or prolongs sounds, syllables, or words. There are several types of stammering. Number one, and the most common, is developmental stammering. This is the most common type of stammering in children. It usually happens when a child is between age 2 and 5 years. Now the other one is neurogenic stammering. Neurogenic stammering may happen after a stroke or brain injury. If a child has sustained head injury, he may stammer. So this is called neurogenic stammering. Now the third one is psychogenic stammering. Although it is not very common, it may happen after repeated emotional trauma. If a child is in the environment of emotional trauma, then he may stammer. Stammering may be worse when the person is excited. You must have noticed that a person who is stammering, and when he gets some stress or excitement, he starts stammering more. Or if he is tired or under stress, or when feeling self-conscious, hurried or pressured. Situations such as speaking in front of a group or talking on the phone can be particularly difficult for people who stammers. Many young kids go through a stage between the ages of 2 and 5 when they stammer. In many cases, stammering goes away on its own by age of 5. So parents should know that you should not be in hurry, and you have to just watchful wait, and many of them get out of it at the age of or after the age of 5 years. In some kids, it goes on for a longer time. Effective treatments are available to help child overcome it. What causes stammering? It is not sure why some kids stammer and others don't. Stammering may be genetic. Kids who stammer are 3 times more likely to have a close family member who also stammers. Statistics show that males are much more likely to stammer than females are. There are some risk factors predisposing to childhood stammering. Number one is the stress in the family, high parental expectations, or other types of pressure can worsen existing stammering. The first sign of stammering tend to appear when a child is about 18 to 24 months old. Stammering may be upsetting and frustrating to parents, but it is natural for kids to do some stammering at this stage. Be as patient with your child as possible. A child may stammer for a weeks or several months, and the stammering may come and go. Most kids who begin stammering before the age of 5 stop without any need for help, such as speech or language therapy. But if your child is stammering happen a lot, gets worse, or happens along with body and facial movements around age 3, then you should consult a speech language therapist. Now, when to get help? If your child is 5 years old and is still stammering, talk to your speech and language therapist. Now, how you will cope with this stammering child? That means coping and support. If you are the parent of a child who stammers, These tips may help you. Now there are 7 tips for talking with the child who stammers. Number 1, reduce the pace. Speak in an unhurried way, pausing frequently. Children need a lot of time. Model a slower rate. Add pause. Take time to reply. Ask one question at one time. Let them finish. Children will follow your lead. Number 2, ask questions. Don't bombard with questions. Avoid complicated questions. Ask one question at one time. Give child time to respond. Turn questions into statements whenever possible. Number 3, full listening. Eye contact is important. Focus on the message. Use a facial expressions to convey that you are listening. Use body language to convey that you are listening. It's okay to let your child know when you do not have time to listen. Suppose if you are driving and your child wants to talk to you or he started talking to you, you can just tell him that wait for some time, then I will listen to you. Number 4, taking turns. This is very important. Taking turns supports fluency. If you have other children and you are sitting on a table, so give them chance one by one. So you can use an object to indicate whose turn it is. Everyone gets an equal turn. So suppose he is sitting with you. So put one object in front of him or her and tell him that okay, this is your turn to speak. So when he finishes or she finishes, then you just move this object to the other child and let him talk. In this way, you will see that his fluency is improving. Number 5, building confidence. Focus on strengths other than talking. Use descriptive praise. When you want to praise your child, just use descriptive praise. That means be specific in your praise and be specific in your descriptions. Number 6, special times. This is very important. One undivided attention. 5 minutes at least a day. No distractions, no TV, no phone, no computer. Use one skill and see how it goes. Make a special time for each of your children. Now 7, this is very important. Normal rules apply. That means for all of your children, one is stammering, another is not stammering, so treat them all equally. So discipline the child who stutters just as you would in any child. So don't make him a special child or anything. Just treat him all as a normal child. Now, what is the take-home message for parents? Accept your child as he or she is. Don't react negatively or criticize or punish your child for stammering. This can add to feelings of insecurity and self-consciousness. Support and encouragement can make a big difference. Thank you. Stay blessed.